Hello, this is Fadi Al-Fayoumi, and this is the presentation 13.1 for the Capstone A project at Washington State University for the Vein Clinic. This week we're going to be talking about the key activities, education, and the cost structure. The number of the gurus talked to is 3, and we use the same 10 customers from last week to use the questionnaire and fulfill the requirement of this week. So the key activities were the quality of the service. It has to be at the state-of-the-art level. Education as a key element in the success of the clinic. The key resources will be the expert care coming from the primary care doctor, from the primary doctor involved in the treatment of the varicose veins, which is going to be myself, along with the mid-level providers, the MAs, who can help sometimes with the sclerotherapy. They will prep the patients for the procedures, and they will take care of the educational activity after the procedure is done about what's expected for the next couple of days, what kind of pain medications they have to take if they need to, and what kind of discomfort level they should expect, if at all. The support personnel will be the same thing. When we talk about the cost structure, we'll be talking about the state-of-the-art technology cost, the training of the personnel, the advertising, which is going to be a major cost element in the success of the clinic, particularly in the initial phase of the 6 to 12 months before the word of mouth becomes the major referral center for the clinic and the major advertising element for the clinic, of course, and of course the education cost. So when we ran the survey for the gurus, we asked many questions. What are the key activities does our value proposition require? What key activities do our channels require? What are the key resources to be operated and required? Which costs are more likely to be more expensive than the others? Which are the key costs that we have to spend more money on because they are key elements in the success of the clinic? And when we ran the questions to the patient as far as the quality of the service being provided to them, we asked him questions like, would you prefer if your doctor is board certified as a reflection of his knowledge in the field or not, rather than board eligible but not essentially certified? How do you feel about mid-level providers? Would you like to have seminars to attend to listen to the doctor explaining to you the pathophysiology of the disease, why this is important, and why you should get screening and therapy if required, and what your expectations should be? Would you prefer brochures as a printed materials? Would you like just to see it quickly as an ad on TV? Or would you like to have the education provided to you as face-to-face? And when we ran that surveys question between the gurus and the customers, our hypothesis was that the activities, the quality of the care, the education level, the personnel required between the doctors and the staff, along with the cost, equipment, and the marketing, through the phone interviews with the gurus and the surveys with the patients, our conclusion remains to be that the education of the patients is a key element for the customer satisfactions, for the surveys, and for the success of the clinic, for the key activity of the clinic to become a logo for the clinic, that this clinic is not only about diagnosing and treating vein conditions, but it's also about education, and the patient satisfaction comes from this particular part, and that's an important quality measure. When we talk to the gurus about the cost, and yes, the cost can be measured when it comes to the buying the equipment, the advertisement, but according to what most of the vein clinic experts looked at, in the current reimbursement environment in the United States of America coming down, particularly for cardiologist services, in order to contain the cost in this very difficult economical time, adding a vein service and adding a vein clinic to the doctor's services, provided you have the right training and the right education, adding vein services to a cardiology practice, which is typically a cardiovascular practice involving not only the heart but also the arteries, and now adding the veins is nothing new to the cardiologists in their field of education. And therefore, if they pursue the right education with the right quality measurements, with the right reimbursement pattern following the guidelines of the insurance companies, as we always do when it comes to the cardiovascular medicine, then the cost will be contained, and it will be very lucrative for the cardiovascular practice down the road. And that's our conclusion for this presentation.